We've been hearing from Canada's health officials, including the top public health officer. More than 325,000 tests for COVID-19 have now been done across Canada, 325,000. And they say the process is ramping up daily, and that in Ontario, for example, the backlog that was in place has now been cleared. But you're going to hear the story of one Ontario woman who certainly experienced the process that failed her, and she believes it's not covering enough people. Let me introduce them to you and the story of both this woman and her daughter. Well, let's listen to this little bit of tape first of all.
They have to start testing more. There is so much talking about protecting our fathers, our mothers. The stores are open earlier only for them. But yet, when I got sick, when I was so scared that I'm living with my father who is so vulnerable, he's so sick, and deep inside I was hoping that I don't have it, but I did have it. And they didn't test me. And now my father is dying. How is that protecting our parents? It's not. They should have tested me first.
That is Agnes Sokolowska. She is joining me this morning from her home in Mississauga. She posted that video, and it is a very poignant one, 16 minutes on social media. Agnes, I'll be with you in just a moment. Let me say good morning. I also want to bring in Agnes's daughter, Isabella, who is in Morocco and unable to get home to be there as this family drama is playing out. Isabella, good morning to you as well, and thank you very much for being here. We have both of you, and I'm thankful to have that conversation. Agnes, let me just begin, number one, with how you are doing, how your own personal health is this morning.
Well, mornings are the worst. Good morning, first of all. Thank you for having me. Mornings are the worst. Coughing is very bad. I already drank like maybe 2 liters of water, warm water with lemon. So I stopped coughing a little bit because I want to do this interview.
Well, we want to hear your story.
Overall, I'm happy that I don't have any complications. It's been 2 weeks, the worst 2 weeks in my life.
For your own health and also concerns about your parents. We could tell from that Facebook testimonial, your story as you told it to social media, you yourself feeling unwell with some flu-like symptoms, and you tried to get doctors' help, and you tried on several occasions to be tested. What happened?
Yes. Well, I believed when I called my doctor, like I said, I don't want to blame anybody. I don't want to blame my doctor because they were following the rules. I called my doctor, and she says, well, I told her all my symptoms. She says that it's probably flu, so I should be careful. But, 3 days later, my mother got sick, and I called her doctor, and they both work in the same facility. My parents' doctor and my doctor, so they are aware about the situation that my father was very, very sick and with compromised immune system. So I heard the same, that okay, you have to be careful, but because she didn't have a problem with breathing, again, she didn't have criteria for testing. So even though she had a fever. At least I didn't have a fever. So anyway, so then my mother got sick. I had to take care of her. When my father got sick, I know we don't have a lot of time. When my father got sick, a couple days later, he was the last one. I separate them, from my mother was upstairs, my father was in the basement, and I was still sick, and I was taking care of them. And I did everything I could. I was just so scared and so disappointed that they didn't test me, but because I thought maybe I would save them. And at that point, I didn't have any more masks, so I couldn't protect them really like I would like to.
So
And
We should do.
yes,
Your mom's 75. Your dad's 80 years old. Both now with
yes,
COVID, and your father in pretty in difficult
in ICU.
in
I
ICU in difficult
yes.
situation. What are the doctors telling you about his prognosis?
Well, tomorrow it's gonna be a week. Like I called 911, and there's no changes in his condition. So
Is he on a
not a
ventilator,
lot.
Agnes? Is he on a ventilator, your
Yes,
dad?
yes,
He is as
yes,
well. So he's in the
yes,
worst of these situations. Well,
yes.
we'll think of him warmly. But the point dealing with not only the concern about your parents, but the point of your story is that you're feeling horrible about having given them the virus because you didn't know you had COVID-19.
No, I didn't know because I believed that it is a flu. Even though I had like 90% of all the symptoms of COVID. And that's why I'm just so disappointed with the system that it shouldn't be that way, especially if you live under the same roof with somebody who's so vulnerable, whose immune system is weak, and like in my case with my parents,
Yes.
when when I didn't want to hear when I explained my symptoms, I didn't want to hear that this is the flu. I wanted to hear that my symptoms are like COVID-19 symptoms and I should get tested immediately so I could protect my parents. Because you know what? I would do anything. I would rent a motel room to just get out of the house.
Yes.
And my sister would have been able to take care of them, like not directly, but my mother is in really good condition. She's not sick, like she doesn't have any serious problems, right? So
It's your
she could
father
have.
right now. Right.
Yes. So I mean,
Agnes, can I just bring in your
yes,
daughter? I just want to make sure that we talk to Isabella for a moment or two, too,
of
because
course, of
all of
course.
this is happening at home with your mom and your grandparents, Isabella, and there you are in Morocco. I mean, what is it? What has this been like to follow from afar?
It's been really intense, to be honest. I didn't imagine that it would hit home the way that it did. I imagined that I'd be more susceptible to it because there's been so many European tourists where I am. And I was almost preparing for that, more so than imagining that my family, my mom, my grandma, my grandpa would get COVID-19. So it's hard.
It must be hard. It must be hard to have conversations with your mom because I can see how torn apart she is with all of this. Are you having regular discussions with her and helping her out?
We're talking every day.
I'm sure you are. What about coming home, Isabella? Is that a possibility?
I mean, it's not right now. There's no more flights that are available. And all the flights that come out, they come from Casablanca, which is really far away from where I am. I'm in a very remote town. And we're on lockdown here as well. So there's no public transportation. There's no cars. It's a really tricky situation to get all the way up to Casablanca to even get that.
Have you been able to talk to your grandfather at all since he fell sick, Isabella?
No, I talked to him, right, I think maybe on day 2 of him being sick.
And at that point, what did you tell him? What did you talk about?
We just talked about what we always talk about, random, funny things. He's amazing. He's the best.
So people who are so dear to you in the situation that they're in right now, and you can't get there, and you won't even be able to talk to your grandfather at this point, how do you feel?
Just, I honestly, the only word that comes up is surrender. Like, I can't, like, it's just so crazy to be in the situation where there's nothing I can do. There's nothing I can do to get there. There's nothing I can do to see him. There's just nothing I can do. So it feels very helpless. And it's heartbreaking. Like, it really is heartbreaking. Like, I'm really using all my tools to keep it together right now. I have to.
Yes, you do, and to be there, a source of support for your mom as she goes through all of this. Agnes, I'm going to have to, we'll follow along with your story, obviously, and we'll look forward to updates, and we'll hope for the very best for your mother and certainly for your father. But the message of all of this is, they're doing more testing, they're getting to more and more people, and they say the system and the backlog is improved. But what do you want health officials to know, based on your family experience, and understand about,
I want to. That was the whole point of the video, because I was still very sick when I decided to make that video. I just want to ask them to stop, not to neglect people like me, because again, now I feel very, very bad about all of that happened to me, and I wasn't tested first. Again, you have to test people who get sick first in the household, full of vulnerable people, full of people who has a weak immune system.
yes.
It shouldn't be done this way. I'm just so heartbroken, about all of that.
And is it? Obviously sadness for your father, but just on the point of
Yes.
guilt, Agnes, on feeling about how is that sitting?
I don't know how am I gonna ever get over this. I don't know how am I gonna get over this guilt that. And you know what? I've been thinking over and over again, when did I get it from? And it's just killing me. And I called all my clients, my old clients, like the elderly that I work for, that they need me, because they started to call me because they knew I have a flu. But they started to call me, what's going on? And I was scared to tell them that I have a COVID. I know that's COVID in this my household, because I know they all have a weak immune system, and when I called them, they're all okay, and I'm so happy that they're all good.
I am too.
And
Agnes, listen, there's a lot there, and hopefully Isabella is a big source of comfort for you, but there are people to whom you might want to talk. There's a lot there that you're carrying, and we're thinking of you, and of course the physical health of your family members, but your own burden too. So you be well, and please stay in touch, and we'll be speaking to you. Isabella, I thank you for your time today there in Morocco, and your family, and your part of the story in all of this. And Agnes, thank you very much. All the best.
Thank you very much for having me.
Thank you.
So much. Thank you. Bye-bye.